Pain. You got double pain. So why are we doing the test, my friend?
55-year-old female.
Mike. Is it? Hey.
55-year-old female came to us with complaint of altered bowel habit since 8 years and bleeding PR since 3 months.
Okay.
On examination, diarrhea and proctoscopy is unremarkable.
Okay.
History of weight loss is also positive.
How much?
About 5 to 6 kg.
Over how long?
Within 3 months.
Okay. Happy?
Does she have any comorbidities?
No.
You start with one Kens there, one Kens, and then later 1 milligram of problem.
What? Who was it?
Yeah.
It was Lorraine. I phoned her. She's phoned you back. I've told her she's all right for tomorrow morning. She put you off because she was stood there in her pyjamas.
He wouldn't have minded. So, Lorraine, who was on the internet, you wouldn't have minded seeing Lorraine in her pyjamas, would you? No, he wouldn't mind. He's very, very liberal.
Lorraine might.
Akram, chicken fish.
Where is?
Chicken fish.
Chicken
Chicken fish.
Chicken fish. Okay.
That's where tonight, chicken fish.
Night.
Tonight.
Chicken fish.
Very good place. Port Can.
Yeah.
Very good place, I must see.
See, oh, the sea, the beautiful sea.
Yes.
Only pass between
Karachi Port. Near
Karachi.
Karachi.
chicken fish.
Like chicken and fish.
On one of the courses we went, what's this? Chicken fish. So we ate it all the same. Oh, sorry. So no surprise attacks. So tell me what you do. Yeah. Yeah. Okay. If you have a look at your little wheel, what position is your wheel in already? Is it neutral? No. Okay. Okay. Good. Excellent. So what are you doing now? Good. Good. Lovely.
Should I circulate?
Excellent. Ah, you knew I was going to kick his foot. He saw me looking at his foot. Excellent. Keep going. Keep going. Keep going. Keep going. And let your shoulder come down. That's it. Relax. And then the scope will go straight. Wonderful. How's that? So you've gone anti-clockwise instead of clockwise around that. Do you find that different to what you've been doing previously? Because before you would have gone this way. and now you've gone this way. Is that any different? Is it easier? Okay. Rima.
Why?
No, you.
No, I am happy.
Are you?
Should I just push?
No.
No.
Shall you just advance?
Yeah.
Yes. Look up.
Yeah, it's full, yeah.
Okay. How are you going to make that look even further up? A little bit of torque. That's it. Now advance. Big wheel all the way back. There, you see. So what happens is when you've got the torque, right, and then you advance, it wants to go and it comes back on itself. But when you put the torque, the fold is here. And if you do this, it pulls it. But if you actually then put the torque, it comes by, and then you can do this. Sorry. And what are we doing now?
तकलीफ तो नहीं हो रही?
Good man.
अम्मा ठीक है आप?
दर्द तो नहीं हो रहा? हो रहा है? She's feeling a bit discomfort.
Okay. One man's discomfort is another man's pain. This man's in discomfort, but he tells me it's pain. How does the scope feel? Go. Okay. First thing I do when I think the scope's gone a bit stiff, what do you think it would be? If you think the scope's gone stiff, what do you...
Maybe looping because
Well, forget the looping. You do know that you're forming a loop. How do we know you're forming it? Take your right hand off the scope and put your hand here. How do we know we're forming a loop? No. The scope is staying up. Can you see how the scope is staying on its own? That means you're actually starting to form a loop. So it's staying stable in the bowel. If the bowel was all nice and relaxed, that scope would lay flat. So you are about to form a loop, that's one thing. But the scope that could be causing difficulty in advancing the scope. What else can be causing difficulty in then not allowing the scope to go forward?
maybe need more lubrication.
Okay, so the first thing I do is take the scope back 3 or 4 centimetres, lubricate that bit, and then slowly pass it back in. So I always take the scope back 3 or 4 centimetres, lubricate that bit, and put it back in. There's no point in lubricating the bit you're at and then continuing. Take it back, lets the bowel relax, lubricate, and then re-advance. How does that feel now? For you or for her?
अभी भी दर्द हो रहा है?
So what's she saying?
नहीं, she's better.
That's fine. So sometimes you get this draggy feeling on the anus and it causes tenesmus and a little bit of bad feeling. So slow your movements down and you will be fine. Slow your movements down and you will be fine. Slow your movements down and you will be fine. Excellent. Excellent. Slow your movements down. Excellent. Pretty little angel eyes. Pretty little angel eyes. You've gone very quiet on, my friend. You were very talkative very early on.
Yeah, I'm just
So what are you doing?
figuring out what to do.
So while you're figuring out, you tell me what your figurings are. You know when you did your maths when you were a young boy, the school teacher said, "Show you're working out, young man." Didn't he? So show me your working out.
And up, bit of air.
Yeah.
See, just roll, keeping the thought. Move back because of
Good.
the view.
Good. That's absolutely excellent. Excellent.
Keeping the thought and just enhancing.
Yeah.
हमारी तकलीफ तो नहीं हो रही?
You're doing very well. And what? Keep your eye on the screen. The scope is actually going forward on its own. See it? Rima, she okay?
Yes.
The lumen is
So clockwise torque. What torque are you going to put on? You don't have to move this part too much. Pop that there, drop this here. If you actually want to make that work, you don't have to hold it up and then move it across. You just have to do this. This. See it? See it? And that's by allowing that to sit there. Good. Again, you're doing the same thing. Let your hand relax. That's it. Let it relax. And all you do is bring this here. Now big wheel back slowly. And just increase it. Turn your shoulder. Allow the clockwise torque to come in. Relax the big wheel just by a few degrees. So just allow it to relax by 20 degrees. Relax. That's good. And now encourage the clockwise torque with your right hand. Tip up. That's it. And now a little bit of air, and you'll find it's just down here at 4 o'clock. Once you bring the scope back to neutral, it will come central. There you go. It's coming central, and it'll be in front of you. Excellent. See it? And that's because it comes round, goes past, and then comes back. Yeah? Doing good. Very good.
Keeping the clockwise torque.
Yeah?
Advancing.
Good. Slowly apply that clockwise torque. Slowly apply it. Tip up. A little bit of anti-clockwise now. Good man. And where's the lumen now, do you think? Still up there. Okay, that's taking it to 1 o'clock. It's more 12 o'clock, isn't it? So you need to get your nose up. How are you going to get your nose up in the air? So tip up. And slowly advance. Tip up. Keep the tip up. You're allowing that wheel to move. I can see it. And just advance the scope ever so slow. A little bit of air. Good man. Now where do you think the lumen is? Can you see how shiny it is on one part and dark on another? Where is it darkest? 12 o'clock? 6 o'clock? 12. Draw back the scope. Big wheel forward. Now where? See it? Off down at 8ish. So if you actually looked, you saw that it was shiny at 9, shiny at 3, a little bit shiny at 12, and it was an edge darker at 6. So that's how come I knew it was down below you. Now if you look again, it's anti-clockwise, and you'll see where to go. Excellent. Yeah. The hardest trick to learn in colonoscopy, and it's not a trick, is reading the signs. Okay? It's reading where the lumen is. Now, how are you going to reduce that? No, not the loop. That's it, you're doing it. That's it. Sorry?
She's having some pain.
Okay. How does the scope feel?
Not feeling that bad.
So when you say it doesn't feel that bad, you're what doing it? Advancing it?
As I'm advancing it, the mucosa seems to be going back. So I may be forming a loop.
You're possibly forming a loop. What do you think would make her feel more comfortable? Is it just advancing it slowly? Do you think we've given her enough sedation? Do you think we've given her enough pain relief? Do you think... So, the reason why I address the medication aspect is because, one, you're advancing nice and slowly, and it's going in. Two, we've not got too much air in, so those things are actually okay. She's in the left lateral, we're trying to keep her comfortable as possible for dignity. Maybe the easiest form would be just to give her a little bit more at the present moment in time, another 1-1, just see how she goes. Give it a couple of seconds, draw back the scope and then go. That to me is probably the easiest option at the moment, and then let's see how we progress from there. If that doesn't work, then we then can progress into possibly changing position and things like this. And if it was a gentleman, I'd say position change and just go straight for it. A lady, I tried to actually.
So we give more drugs.
Well, no, you tell me. I've put all the options in front of you.
Okay, we give more energy.
So what do you want to give?
Okay, just one.
A 1-1 or just one? One of
Yes.
each?
Just an analgesia, I think enough. It will opiate will sedate her as well. And make the patient.
I tend to give both. I would give 1-1 myself if you were asking me. But what do you want to give?
I would give both.
Both.
1-1.
1-1. You'll probably find that you're still giving, even when you've given a total of 2 and 2, you've still given less, much less than what you would have given your own department. So don't think you have to start off. It's better and safer to start off with low, but it's also better to actually do the correct thing for the patient. Okay? We probably will end up putting her on her back, probably will, but I'd rather try this first. Okay. While she's not had this stuff yet, so try not to do anything until she's had the medication. I wouldn't bother, just wait. So she's happy now, so away we go. More. More. So start with your thumb at 6 o'clock and apply the torque. Good man. And tip up. Slowly, 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 slowly. No, just pop the scope down just for a second. You're doing good. Just pop it down just for a second. Let it sit there. Let it go. Just pop it down. I'll make sure it doesn't drop off. Just let the scope just sit there just for a moment. If we look at here, you can see what's happening. The scope's coming up and it's round. So it's actually looping up into the sigmoid colon. If we look at the bowel, if you see there, see how it's darker at the top? See how it's lighter around here? So that's suggesting that maybe the lumen is a little bit up at the top. Alright? So we're just letting it relax at the moment, letting things settle. So first thing to do is have a look at the scope. You've got the little wheel forward, so let's neutralise the little wheel. Okay, that's fine. We're still looking at 12 o'clock. We've got the big wheel neutral now, so that's all fine. Let's just take the scope back just a fraction, a little bit more. Now, where's the lumen? Okay, what can happen is that that's where we want to go. This is and we catch our folds here. So what we need to do is here and shorten the scope. Stop, advance, shorten the scope, stop, and then go. That's hard. So have a look, see if you can do that. So slowly apply it. Don't go clockwise, anti-clockwise. Just apply the big wheel back slowly, see what happens. And now a little bit of anti-clockwise. That's clockwise. Anti, that's great. And stop. Now neutralise the big wheel again so it goes forward and draw back the scope another centimetre. That's good. Now try it again. Big wheel back. Good. Keep going. Keep going. Keep going. And stop. See how the vascular pattern is changing. So let me just have one little look for you. And just stand there for a second. So we'll take off that, so we get rid of that. We sit it here. No, you need to stand there. Little wheel. So here, we take the scope back. And now we just let it sit, no problem. Take some air down. How's she feeling now, Rima?
अभी तबीयत कैसी है?
you say better? Okay, so if you looked, what we had is a lady who had a little bit of too much air. Now I've gone anti-clockwise, more. I draw the scope back. I'm keeping the anti-clockwise on because it's under the fold. See the folds there, so you keep it on. The scope itself, I'm trying to steer. See where it wants to go. See the fold here. You pick where it wants to go. See it? So the big wheel is back, keeping the scope up, keeping it up, and advance ever so slow. I've let go of the scope, so you don't even have to do anything, and allow the scope to return to neutral as it goes round. As it goes round, I just support the wheels, and then draw the scope back. Coming round, I allow it to come back, and then draw it back. If you look, you can see where it wants to go, which is down here. I'm not bothered about letting the scope go, because I know the scope will come back, because I've got what the scope will do for me. As you can see, a little bit of liquid. Can you see this fold that's in front of it? If I push the big wheel forward, I drop short of that fold. If I just blow a little bit of air, advance a centimetre, and now clockwise torque, I now wheel knowing that the lumen is up above me, and I come back and I can see where it wants to go. I put the anti-clockwise clockwise on. I'm always trying to get the lumen 12, and the little indicators are telling me it's up here, it's up here. So you come back all the time. It's now off to one side, and again it's trapped under that fold, so you can see where it wants to go, but I want it to go this way. So a lot of people would push at this point. We don't, or I don't. Big wheel back, advance the tube, so we just go to a little bit of anti-clockwise. You can see where it wants to be, allow it to come back, see the fold again, and allow the scope to relax. As the scope relaxes, she'll go and advance and come back again. It's over here, and then just advance. So it's gone round, yeah? Suck the air down, draw the scope back. The tip has to be central to the lumen, otherwise it's got nowhere to go. We've negotiated that bend, and in negotiating that bend, we suck and just let it go, and again draw back, and again draw back, and again draw back. Let it come back, and then go forward. Alright? Now just let it go nice and slowly. Again, the scope is stiffening. Now it could be the fact that we're looping, which is more than likely. It could be the gel that we've got lack of. Alright, so I'm going to now bring in the scope so we actually get it so it sits here. And let it come back. Rima, could I have some more gel, please?
More gel.
And suck. See it there? When it went round? And there we let the scope sit. So I aimed it, it had to go through the lumen. It can't go forward, and it was catching one of the folds. So the tip of the scope, think of what the scope end looks like. It's a blunt end. It can't go past the fold. So that's what was pushing the scope back. So you've got to steer it through that part there, the tip. So it has to go centrally through the lumen. Yeah? Now we've got that. We look at here and there. Come back, go forward, and suck. Okay? So what it does, the scope tip is here, so it's here, right? So if we think that's the lumen, so that's the lumen, the scope tip is here, and as you draw back to go round, it was pushing this forward, then it pushes itself back. You want the scope to go round, and it can't go forward, it has to go through the centre. Because this was small, it was catching one of the folds and pushing itself back. So what I had to do was torque it, then it went forward. Yeah? Happy?
With clockwise down.
Yeah? So how long have we been going? How long have we been doing this?
Yes.
20 minutes from the start, or is it half an hour?
Yeah, but 20 minutes.
No, but how long has this one been going? 20 minutes?
15 minutes.
15? How long are we... When did we start, was the question.
Eleven 40 20 minutes.
20 minutes, that's fine. 55, so 25 minutes. 25? 20 minutes. 20 minutes. The only reason why I ask is that I give you 40 minutes and then... Excellent. Nicely kept view. Good. Nicely kept view. Come on, man. Sit down. He's got out of that chair to let you sit down. You see? He's looking after the elderly men. So where's the lumen? Up. There, you see? So can you see how it is to get caught underneath? It's like a ledge that's in front of you. This is where it wants to go, and you get caught, and you don't... Forever looking. It's like it needs to be over there, but it's actually up here, so you have to take it out, up, chin up, push it down, go forward, and that's how... Good man. Slow your movements down. Do not feel under pressure. Slow. When you slow it, so hold, advance slowly, tip up, advance slowly, keep going. You've got to get past this before you start doing anything. Advance slowly. Advance slowly. Go on. Advance till you get discomfort or pain, or it's unsafe to do so. Is it discomfort? Keep going. Tip down. Tip down. So tip down, and then anti-clockwise. Okay. Let me just show you. You take over in a second. All right. So what you're doing fine. That's admirable. What you want to do. But what you're going to do is come back. All right. Just a fraction. There's where the lumen is, where you want to be. Aim for the centre. Blow a little bit of water so the water is blowing. That's all I'm doing at the moment. I blow the water, I'm looking at the lumen. Tip now goes forward. I let the tip relax. See the folds all converge. There. Once you're over this, then you can actually then reduce the scope. Suck the air down, and now let it come back. That's how you get past. So you know you're going to cause a little bit of discomfort, but you have to, because of the air that you've put in. So your air you've put in is a little bit too much, because when we do these tests, we tend to put a lot of air in. Now you can see when it wants to go. Where's the lumen?
11.
Is it 11 or 9?
That is part of
11 or 9?
Now it seems more like 12.
So as the scope comes back, you see it. If you look at this on there, you'll see that it wants to go round. And all we're doing now is just reducing what we've got. Now, if you look, you can see where the scope wants. See the folds? 11 or 9. See how we're coming back ever so slow? 11 or 9. And then come back with the scope. So you can, again, we take the air down. How is she now?
swelling, with pain.
How about now?
No, she's okay.
Right. So what we've got, we may need to pop her onto her back. So if you come onto her back, if you don't mind.
अम्मा जरा कमर से बंद होके लेटिए, सीधे हो जाइए. थोड़े से. Thank you. अभी तो सीधे हो जाइए.
Now she comes onto her back because she tenses up her abdomen.
दोनों टाइम को मोड़. एक सेकेंड. उठाइए. Good. Very good. थोड़ा सा दोनों को. ये देखो.
See a fair bit of air, so we're just taking that air out. I'm just taking it back so we can keep that air down to a minimum. What's she saying now? Now if you look at that there now, that suggests that it's straight. I wasn't looking at that at all, but that suggests that the scope is straight. And now the scope can go forward. And all that was about straightening the scope. So keep the scope straight all the time. Yeah? So what you're going to do with the scope, draw it back a centimetre and keep the lumen central.
What is the extent of given pressure over the sigmoid on the left leg fossa towards the right abdomen?
You're getting someone to put abdominal pressure? You mean if Rima come along and put pressure there? I think it's...
Most of the people here,
We'll put
I have noticed here, instead of changing the position multiple times, they initially used to give the pressure
And I bet you every time they apply that pressure, the patient goes, ah! You push and the patient goes, ah! Because they're applying the pressure in the wrong place. I put the patient on the back, I draw the scope back. How many times have you ever seen me use abdominal pressure?
No, I haven't used pressure. That's why I am asking
Yeah,
you.
I never use it. It's
Never.
garbage. People don't put it in the right place. The only way to know how to put it in the right place is this button. Do you know what it does? Do you know why it's this shape? The reason why this is this shape is you get this. Can you just let her know I'm going to put my hand near her? And you get your hand. And this then, that's if I want to apply pressure there, I now know that's where I apply the pressure. This is the only thing you should be doing. You applying pressure here, right? This is where the sigmoid is. What the hell is it doing over there? This is where people put the pressure. But if I wanted to apply pressure, I now know that's where I apply the pressure. That's what this is about.
No, it's not on the
Yeah.
right
But if you haven't got,
and
yeah,
the
but if you were going to be doing it and you want to do it for the correct way, that's the only thing that can help somebody. But I think abdominal pressure is poor. I really do. It just encourages you to push because somebody else is applying the pressure. And I think it's a poor technique. Poor technique. How are we doing? Do you want abdominal pressure?
Yeah. I think this is the lumen.
Yeah, below you. Below you.
Now clockwise.
Now don't fish. Come back. So don't go fishing. Know where you think it needs to be. Where do you think it needs to be? So when I say below you, go forward, below you. That's it, that's below you. So tip down. Often the best way to do is anti-clockwise. So watch. Anti-clockwise. Yeah, that's it. Anti-clockwise. Now, stop. You ask yourself, why is she uncomfortable? I've given you the scope and she was comfortable. Why is she uncomfortable? Okay, your finger is on the blow. Okay, it was as you brought it down. Okay, have one more go at trying to get it round. So get your luminal view again. Good. Good. Now advance. Good. Slowly talk. Turn anti-clockwise. Slowly. Big wheel forward. Slowly. Slowly. Excellent. 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 Stop. Now you go round. Big wheel back slowly. Excellent. Tip up. Excellent. You see? So doing it slowly enables the things. And now bring the scope back up and you'll sweep around. Go on. Go on. Go on. Go on. It's pointing this way. That's it. Don't blow. Now don't suck. Sorry. Just blow. Blow a little bit. Go on. Be encouraged. Yes. Now this way. Yes. Now that way. Yes. Now the other way. Yes. Are you enjoying yourself? See, even he says yes. Happy. Don't suck. Blow a little bit. Excellent. A little bit more. Bit more. No. Let me show you. Let go of the scope. Let go. Yeah, I've got it. Let go. See, it doesn't move. A lot of people grip. Watch. A little bit of air. Just a little bit. Pushes you away. Draw the scope back. Advance the scope. And there you just keep it central. Keep it central. Blow the water, not the air. Let the scope come back. Tip up. Now she should start to feel better. How's she now, Rima?
Yes, she's okay.
You see, so what we had to do there was, the only reasons why I take over is to take the air out over the next bit. It discourages you if you think, oh my God, I'm causing pain. But you're not causing pain, you're causing discomfort because you're getting a bit too keen with the air button. Alright? So, our history is 8 years of what? What's the history of the patient? Don't ask them, you remember.
Sorry. I don't know, 8 years history of altered bowel habits, and 3 months history of bleeding PR with weight loss of 6 kgs.
Okay. So what's the intention of this test?
To look for any sinister pathology like a malignancy.
Okay. What's the likelihood that you would find something on this test? Low. But we do it because it's the right thing. Now that thing in front of us is the appendix. There. See it? Now, do you remember how that points to where the...
Yes, I said first, so this IC valve will be somewhere between 11 to 9.
Yeah, just there. Okay? So that's all normal. You try and get in. Doesn't necessarily have to get in, but you're round now, so you're happy. Are you happy?
Yeah,
Bit. Bit. Good. Slow down. Good man. Nice and slow. I'm going to have Eric's seat. Oh, man.
Most of the people, when reaching the right side of the colon, they not remember the indication of the colon. That's why you are asking always.
Absolutely. It's amazing how many times people get there and they go, he knows that's what I do.
We have one more patient after this before lunch. Then you can go and have.
Tell me what you're doing. Okay, so where do you think it is? You are at the triradiate fold. That redness is where I tried to get into the IC valve. So if that's the IC valve, which is always proximal to the appendiceal orifice, it's not where the convergence is on the triradiate. Well spotted. It is. So why do you think there's very few worms? Why do you think that's probably the... We've only seen 2 worms. Why do you think that's... We've seen very few worms?
Bowel prep.
Bowel prep. Well done. In the UK, because we don't see many of them, we always capture them and send them to the lab, and just for the hell of it. Okay, so you're in the cecum. Are we in yet? No. Let's just have one go at getting in, because it would be important if we can. Not a problem if we can't. Now if you watch, your little wheel was forward, see? So we keep that back. I was looking at it and I was thinking, why is the scope not going in the right direction when you were turning it? So little wheel neutral. Now as we draw back, you'll now see where we need to go. See it? So it's above us. Water, and if it's dropped back, which it has, I don't force it, and then we'll just try once more. Getting into the IC valve can be more uncomfortable than doing the whole colonoscopy. One more go and then I'll call it quits. You can talk to me, you know. Why are you very quiet?
Yes.
Why? Never watch. There you go, and you're in. Happy? Little wheel neutral, big wheel back. You've got the scope, and take the scope back. One left.
Yeah.
So take some air down, and then we can come back. So that's normal. Apart from a couple of thread worms, we can come back now, nice and steady. Take some air down. Make her feel better. Okay. Take the air down. Yeah, she'll feel better now. Is that better? Rima, is she okay?
सब सही है, बिल्कुल सही है, कोई बीमारी नहीं है। वो दवा देंगे उससे सही हो जाएगी।
Take some air down. That's good. She okay?
Yeah, she's asking about the diagnosis.
All right.
अब तो अंदर से दिख गया है ना, सब ठीक आया है, थोड़ी दवाई देंगे उससे सही रहेंगे।
Good. Take some air down. And as you come back, you can see the areas where you got stuck a little, and you were jiggling the scope and catching. You know where you were stuck under the folds, and that's what this are, where you've got stuck and trapped. And it's a little bit, you know, when you see them, you think to yourself, oh right, how did I do that? Happy? Yeah.
Yeah.
So she had a difficult colon, as in shape-wise. Rima.
Where is Janet?
Janet's there on her phone, look, you can see just on the, and now she's putting her phone away. So Janet, everyone's looking at you now, you're gonna, she's back on her phone, look. Sorry?
Fine.
Good.
Telling 10 years of pain, abdomen, stomach pain.
Yeah. So, what sometimes you can get is a lot of abdominal pain when you've had when you've had changing bowel habits, you've had diarrhea, you get what we call IBS, irritable bowel symptoms, and that's very hard to, a lot of spasm, a lot of contractions, wind can cause that to make it worse. So the symptoms that she described, yes, she's got worms, but that won't cause the issue, but her symptoms are very similar to what we would class as irritable bowel, and not inflammatory or anything like that. Nothing nasty, but irritable bowel. Slow down. Don't worry. Just let the scope relax. Let me look at the little wheels, fine. That's it, good. Slow down. Good man. Excellent. Take some air down. She will feel better. Is she better now, Rima?
She's worried about the diagnosis.
Rima, nothing nasty. We've seen nothing nasty. Most important. Now, if you're going to do a J, she needs to be back in a left lateral. Never do it on a back. Always do the J in the left lateral. Yeah? So, are we going to do a J?
Yeah.
So what position does she need to be in? Okay, so good. 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 Take some of the air down. That's enough. Excellent. We're very close to the end. Right, so re-grip the scope at 35. Re-grip this, that's good. So those little aphthous areas there, they're secondary to the prep, nothing nasty. Okay, so now, what are you going to do? Tell me what you're going to do before you do it.
Okay, I'm going to come up here to the first floor and fully up the big wheel.
Yep,
Big wheel completely back.
yep.
And then when that clockwise forward.
What about advancing the scope?
Advance the scope
You need to advance the scope.
and get
Stop. Look at how shape you've got the scope. So, big wheel back, all the way back, advance the scope. As you pull the big wheel back, advance the scope, not the torque,
Just advance.
just big wheel back, advance the scope, then the torque. Is your big wheel all the way back?
Yeah.
And there you go. Now draw the little wheel back at the same time. Back. And there you are. Yeah? Okay. And relax the wheels. So what you can't do is big wheel back, clockwise torque, because all you're doing is just pulling that across here and then you're wafting that across the rectum. You need to slowly pull the big wheel back, advance the scope, rotate the scope, little wheel back, kicks it off to one side and reduces the shape. Okay? And let the scope come out. If you give me the scope once it's come out, I'll show you what that looks like. So take the scope out, suck some air out. Excellent. And take it out. Excellent. Great. Wonderful. So what happens is you had the scope and you went like this, and then you kept the scope still, the rectum is here, and that's what you did, and then you tried to sweep around with the scope right down against the end. You have to advance, keeping the tip central. See how that now looks, this arc? The reason for the little wheel back, see now how it looks. See how little space it takes up, but also it's looking back on itself. The same can be said if you move the little wheel forward, but there's less. On these scopes they work better with the little wheel back. And that's why you do clockwise torque, because then you lead with this, not anti-clockwise torque because you lead with this and cause trauma. Okay? So big wheel back, little wheel back is clockwise torque once you're doing the rotation. Big wheel back, slowly advance, little wheel all the way back along with the big wheel, clockwise torque, and then she will enable you to see. Yeah?